pediatricians are not in general used to treating type 2 diabetes. It's not something that they were generally trained to do. And family doctors, though they were trained in the treatment of type 2 diabetes, will find that type 2 diabetes in adolescence is a much more difficult uh, disorder to take care of. Although the underlying pathophysiology is the same in the adolescents as it is in adults, there are many aspects of the disorder which are more aggressive than in adults. Um, these include more rapid loss of beta cell function over time. They include the fact that the diagnosis can be complicated because of the need to distinguish between type 2 diabetes and type 1 diabetes, which remains more common, even among obese, high-risk minority groups. It's also more difficult because there is a great deal of natural reversibility of this disorder. This disorder is closely linked to puberty, and some kids will develop degrees of dysglycemia during puberty that then revert, and that complicates the understanding of how to intervene in these kids. In those who clearly have diabetes and who have negative antibodies, excluding the possibility of type 1 diabetes, the disorder progresses very rapidly, and there is a much higher failure rate of therapies, including metformin, as well as all of the other oral agents that have been looked at to date. The failure rates are quite a bit higher in these kids than they are in adults. So it requires a much more aggressive approach than people are used to doing in type 2 diabetes if they're taking care of older patients. So a real understanding of the unique pathophysiology of this disorder in kids is necessary to get a good grasp of the appropriate treatment approach.